Hi everyone, I'm so sorry. I apologize. I had 2 emergency procedures, so the complete panna konja time aidichu. I know you're all waiting, and I'm extremely sorry. I'm glad that I could make it live today. Konja late aidichu. I'm here to answer all your questions. And okay. Cherry. Before we get connected, let me all tell you that thank you so much. Lot of messages and Instagram news seri, YouTube channel news seri, and also in messengers. Yes, I am reading many of the questions. Nariya questions repeated irukku, and adha patti na pesradhukku da inda live vanden. So இன்னும் more frequently we'll be coming on live. Um, I still not got the link. You've sent the link, is it? Illiyema. Still not got it. Spam la illaka. Illa illa. Inbox. Okay. Illa inbox la illa. It's not that. Okay, fine. Cherry. So now let's start. Okay. Hi everyone. Yes, Zara. Yes, I was caught up in 3 major procedures. I couldn't finish on time. That's why I got delayed. Sarika, ma'am, what is the normal AFI level of 30 weeks? 35 weeks can taniya illa. The normal AFI level is anywhere between 10 to 15. And 10 to 15 centimeters la normal that's fine. Adukku badala single pocket nu solluvom. Single pocket normal level is between 2 to 8 centimeters. So AFI na 4 quadrants measure panni 10 to 15. Single pocket abdina 2 to 8. And yes, hello, good evening. Okay. Ma'am, pregnancy time la health mix kudikalama? மகா கேட்டிருக்காங்க. எஸ் அஃப்கோர்ஸ் ஹெல்த் மிக்ஸ் இஸ் குட். பட் ஆனால் நீங்கள் என்ன அதில் கலந்துக்கிறீங்கன்னு தான் ரொம்ப முக்கியம். நீங்களா இஃப் யூ கோன் ப்ரிப்பேர் ஹெல்த் மிக்ஸ் லைக் நீங்கள் நட்ஸ் எடுத்துக்க போகிறீங்க, ட்ரை ஃப்ரூட் பவுடர் எடுத்துக்க போகிறீங்க வித் ஹனி ஆர் வித் அட்லீஸ்ட் ஜாக்ரி அப்படின்னா தாராளமாக குடிக்கலாம். சி நோ ஃபுட் particularly anything in excess is wrong in during pregnancy. So அதனால whatever food you take it in moderation. That's the key. தாராளமாக ஹெல்த் ட்ரிங்க்ஸ் சாப்பிடலாம். என்னன்னா the problem is if it's a processed drink ஆனா என்ன ஆகும், அப்போ என்ன ஆகும் அப்படின்னா அதில் நிறைய எக்ஸஸ் ப்ராசஸ் சுகர்ஸ் இருக்கும். ஸோ அதுதான் இஷ்யூ. மற்றபடி when you have a health drink which is made at home, you know what the ingredients are. So you know very sure that what you're actually drinking is what you have used. So அதனால கடையில் வாங்குற ப்ராசஸ்ட் ட்ரிங்க் அண்ட் ஜங்க் ஃபுட் அவாய்ட் பண்ணுங்க. முடிஞ்ச வரைக்கும் வீட்லேயே நீங்கள் ட்ரை ஃப்ரூட்ஸ் பவுடர் இல்லை ட்ரை நட்ஸ் பவுடர் இல்லை ஹோம்மேட் பவுடர் வாங்கினீங்கன்னா நோ ப்ராப்ளம். சுகர் 128 இருக்குன்னு சொல்கிறாங்க. இது நார்மலாக ஹையா மேம்? கலைவாணி, சுகரில் எப்போவுமே வந்து 2 விஷயம் இருக்குது. ஒன்று ஃபாஸ்டிங், இன்னொன்று சாப்பிட்டதுக்கு அப்புறம் போஸ்ட் பிராண்டியல். இது இப்போ ஃபாஸ்டிங்லனா the normal value should be less than 90 to 100 is considered borderline. Anywhere less than 90 overnight fasting is good. போஸ்ட் பிராண்டியல் சாப்பிட்டதுக்கு அப்புறம் பார்க்கறதுல anywhere less than 130 is preferable. 130 to 140 is slightly on the borderline side and more than 140 is high. உங்களது வந்து less than 130 தான் இருக்கு. I presume this is post prandial சாப்பிட்டதுக்கு அப்புறம். So சப்போஸ் உங்களுக்கு வந்து ஃபாஸ்டிங் போஸ்ட் பிராண்டியல் இல்லைன்னா ஜிடிடியில் உங்களுக்கு எதான ப்ராப்ளம் இருக்குது அப்படின்னா தென் நீங்கள் அதை சுகர் நீங்கள் கண்ட்ரோல் பண்ணிக்கலாம், நீங்கள் டெஸ்ட் பண்ணிக்கலாம். பட் 128 ஓவரால் per se it's not an issue, but depending on when you took the blood test. After C-section, when can I ride my scooter or do my routine work? Nishanti, it's a good question. Usually நாங்கள் வந்து 8 minimum ஒரு 6 to 8 weeks சொல்லுறது வந்து it's a time for your uterus to get back to its normal shape. But ஆனால் minimum of first 3 months கொஞ்சம் கேர்ஃபுல்லாக இருக்கிறது பெட்டர். இது vaginal delivery ஆகட்டும் இல்லை சிசேரியனாக இருக்கட்டும், first 3 months post delivery is very important. You don't have ரொம்ப jerky movements வேண்டாம். Yes, you can ride or at least ஒரு 2 to 3 months அப்புறம் post delivery because the roads are not that okay to ride. It's not very or கரெக்டான லேட் ரோட்ஸ் இல்லை. ஸோ கொஞ்சம் பம்பியாக இருக்கலாம் அவங்க ரைட்ஸ். we don't want you to skid, and தட்டும் இந்த மழை காலத்தில் we don't want you to skid or fall down. ஸோ அதெல்லாம் தானே தவிர at least after 8 to 12 weeks, that's 2 to 3 months post delivery, yes, definitely once your sutures and all are heat, definitely you can start riding your bike. Mild PPH in 9 months, please explain. PPH na postpartum hemorrhage, so அது after delivery நடக்கிறது. mild PIH ன்னு நினைக்கிறேன் நீங்க கேட்டது. நீங்க question திருப்பி கேளுங்க, definitely I'll be able to give you an answer which you are asking for. Fetal movements every 10 minutes for almost 2 hours in 23 weeks, is this normal? As long as you feel fetal movements are fine ma. அவ்வளோ frequent-ஆ நம்மளுக்கு fetal movements தெரியாது, கொஞ்ச நாளைக்கு தான் இருக்கும். அப்போ it keeps changing, there's no specific pattern of fetal movements. but ஆனா வந்து every at least after food, say after breakfast, lunch or dinner, or at least or 5 to 10 movements within 2 hours is absolutely a great movement count. How many times feeding in a 4 months baby? Nisha கேட்டிருக்காங்க. There's no specific time number, அதெல்லாம் கிடையாது. It's called demand feed ன்னு சொல்லுவோம். அதாவது baby ஒரு 2 to 3 hours once, if the baby is hungry, it's passing urine well, it's passing motion well, and it's hungry and asking for food, you can feed. So நீங்க ஒரு நாளைக்கு 10 முறை feed பண்ணணும், ஒரு நாளைக்கு 5 முறை feed பண்ணணும் ஒரு ஃபார்முலாவோ ஒரு கணக்கோ கிடையாது. It's called demand feeding. So 2 to 3 hours once, as long as the baby demands and cries for food, as long as you feel that the baby is normal and is active, then it's good. As long as the baby is sleeping, you don't have to wake up the sleeping baby and feed. That's not the concept. It's if she is sleeping, let it sleep. But the only thing is that or 2-3 hours once baby, definitely the baby will want, because the milk, breast milk, the maximum number 90% it is water. Obviously, and the baby, natural breast milk, when compared to formula, it's completely majority of it is water. So adanaala neenga vandu easily digestible ah irukum. So adanaala obviously another 2 to 3 hours la pasikkum. So there is no pattern or timing. Neenga evlo 2-3 hours once, whenever the baby is demanding, you can feed. My wife is in 8th week. She's suffering from itching in the private area and bile back pain. Is it normal? Itching is not okay. கண்டிப்பா 8 weeks pregnancy itching இருந்து white discharge இருந்ததுன்னா that needs treatment. Fungal infection இருக்கான்னு பார்க்கணும், vaginal infection இருக்கான்னு பார்க்கணும். Yes, mild pain is okay, and but itching இருக்கும்போது it tells us there's some sort of infection, so which needs to be treated. So அதனால itching இருந்தா கண்டிப்பா talk to your gynecologist and get your infection either bacterial or fungal infection. அதை examine பண்ணிட்டு அதை get it treated. மேம் எனக்கு PCOD இருக்கு 2 years, பேபி இல்லை, என்ன பண்ணுறது? ஸோ பிசிஓடி மட்டும் might not be the reason. உங்கள் பீரியட்ஸ் ரெகுலராக இருக்கான்னு பாருங்கள். அண்ட் மற்ற லைக் ஸ்ட்ரக்சர்ஸ் லைக் யூட்ரஸ், யுவர் ரெகுலேட்டரி ஆஃப் பீரியட்ஸ், யுவர் ஹார்மோனல் டெஸ்ட், ஹஸ்பண்ட் செமன் அனாலிசிஸ், யுவர் டியூப்ஸ், இது எல்லாமே சேர்த்து தான் ப்ரெக்னன்சி. இட்ஸ் நாட் ஜஸ்ட் ஒன் ஃபேக்டர் ஆர் பிசிஓஎஸ். ஸோ இதெல்லாம் பார்த்துட்டு then you can definitely plan your pregnancy. Okay, so NT value 2.3 நார்மலான்னு கேட்டிருக்காங்க. Okay, so 2.3, it depends on the length of the baby. இப்போ நாங்கள் எடுக்கிற கட் ஆஃப் வந்து 3 mm வரைக்கும் NTக்கு we allow them to go and give the blood trimester on the first trimester screening or the blood test. இதுவே length of the baby say ஒரு 4.5 cm இல்லை 5 cm இருக்குன்னா 2.3 is slightly on the higher side தான். I agree. But இதுவே வந்து if the baby is around 6.5-7 cm, 2 or 2.3 can still be normal range. So it basically depends on the length of the baby and the NT. And up till 3 mm, you definitely go and give the blood test and decide based on the blood test report whether you need further testing or not. Family planning பண்ணிட்டு திருப்பதி போலாமா? Yeah, this is more of like a regional question, but then yes, family planning பண்ணலாம். Travel உங்களால பண்ண முடியலனா at least ஒரு 6 weeks, close to 6 weeks, you can definitely take rest and then travel, not to worry at all. Okay, can you explain about umbilical vein varix and சௌமியா கேட்டிருக்காங்க. Okay, umbilical vein அப்படின்னா தொப்புள் கொடியில இருக்கிற ஒரு ரத்த குழா which carries good oxygenated blood to the baby. So அந்த varixனாலே that means there's a small blood or a blood மாதிரி ஒரு small or whatever size it is, it's a dilatation in the vein. அந்த vein wall ஓட கொஞ்சம் bulb மாதிரி பெருசா வளர்ந்துருக்கும். அதில் blood flow நல்ல சுழலும். ஸோ அதனால என்ன ஆகும்னா சம்டைம்ஸ் இட்ஸ் a very rare thing, it's not a very common thing. ரேராக என்ன ஆகலாம் அப்படின்னா growth நம்ம பார்க்கணும், குழந்தைக்கு blood flow நல்லா போகுதான்னு பார்க்கணும். நம்பர் 3 கரெக்டாக டேர்முக்கு வந்தோன்னா டெலிவரி பிளான் பண்ணிட்டோம். we don't want to have the baby get compromised on the blood flow. இந்த 3 விஷயம்தான். வேரிக்ஸ் இருந்தால் மற்ற உறுப்புகள் நல்லா இருக்கான்னு பார்க்கணும். as long as it's fine, check on the growth, check on the fluid, check on the blood flow and deliver when the baby reaches term. And keep a watch on the baby movements. Sophia, hi ma'ams, low-lying placenta 4 centimeter from extended to the os 37 weeks. Okay, so Sophia basically வந்து 2.5 to 5 centimeter வரைக்கும் மேலே போயிடுச்சு. Beyond 2.5 centimeter na you're pretty okay. இங்க நீங்க 4 centimeter சொல்றீங்க, it's between like between 2.5 to 5 centimeter. Above 5 centimeter na பயப்பட வேண்டாம்னு சொல்லுவோம். It basically depends on your doctor. ஏன்னா at the time of labor தலை நல்லா இறங்க வரும்போது யூட்ரஸ் எக்ஸ்பேண்ட் ஆகும்போது நஞ்சுக்கொடி இன்னும் மேலே போக வாய்ப்பு இருக்கு. Having said that, without seeing the scan finding, it's very difficult to comment on just that one number alone. ஸோ ஸ்கேன் பார்க்கும்போதே நம்மளுக்கு நல்லா தெரிஞ்சிடும் அது 4-5 சென்டிமீட்டர் மேலே போயிருக்கா, இன்னும் கிளியராக நமக்கு தெரியும். பிக்சர்ஸ் இருந்ததுன்னா do send it across in the messenger so we can see and have a look and let you know. Ma'am, if we try during ovulation, how much chance to get pregnant? It is better to try daily or 2 days once. Okay, so at the time of ovulation you try பண்ணுறது naturally 20 to 30% chances every time you try naturally. Yes, if everything else is normal, more than 80 to 90% of the people will conceive naturally when they try during the ovulation time for a particular period of time, say or 6 months to 1 year constantly you've been trying. Definitely at some point of time you will click pregnancy, you will achieve pregnancy. But either way, நம்ம ஒரு IUI பண்றோம் இல்ல IVF பண்றோம்னா the chances depends from one center to the other and also based on the couple's evaluating factors. அதுல வந்து 30% கிட்ட நம்ம சொல்லுவோம். ஆனா ஓவலேஷன் நடக்கும்போது பிளான் பண்ணுறது, ஃபாலிகுலர் ஸ்டடி பண்ணி பிளான் பண்ணுறது, and when rest of the things are normal, you have high probability to get pregnant. It'll daily or once in every 2 days doesn't really matter as long as, because sperms will stay in the track for almost 5 to 6 days, good quality sperms. But egg it'll be there for say 36 hours, maximum 24 to 36 hours. So good quality sperms in and around ovulation, that's the key. Ma'am, I'm from Gujarat, 4 months pregnant. Due to weather conditions, I have cough and cold. While coughing, I have cramps in the lower abdomen. Will it cause distress to the baby? Absolutely no, Jeba. உங்களோட cough பண்ணும்போது the lower abdominal உங்களுக்கு டைட்டா இருக்கிறது, strain இருக்கிறது is your abdominal muscles. So அந்த abdominal muscles தான் டைட்டா இருதே தவிர that has nothing to do with your uterus. Do not worry. The whole thing is for you to feel comfortable. Probably try to hold your stomach while you're coughing so that the abdominal muscles உங்களுக்கு uncomfortable இல்லாம இருக்கலாம். But it will not hurt or harm or cause any distress to the baby. Don't worry. Supriya has asked, how do I get courage to conceive again after losing a first pregnancy? Let me tell you, Supriya, certain things you need to cross it. Sometimes life does throw a lot against us and it makes a lot of us become more and more stronger. So it's very important when you have lost a pregnancy or you recently miscarried, I always tell patients, let's see the positive things in that. Anything, any miscarriage or any type of miscarriage, I would say. What are the positive things? Probably you might have tried for so many years and you conceive naturally. So that's first positive thing. Second positive thing, you conceive naturally and the pregnancy sac was directly attached to the uterus. That's the second positive thing. Third positive thing, unfortunately, so something went wrong into when the baby was formed, so it miscarried automatically. So whatever has happened only for the good, but it showed you that you could get pregnant. It showed you that the pregnancy can sit into the uterus well. So all these are positive things. There are many times that we lose focus on the positive things. This is what we were being expecting for so long and it happened, and now we fail to realize that happened. So adunala it's very important for us to know that yes, nama conceive aga try pannom, adu nadandhathu, correct uterus la irundhathu. So idu ellame nama try பண்ணும்போது இதெல்லா நடந்தது இல்லையா? So இதெல்லாம் நம்ம try பண்ணும்போது நடக்கும்போது why not the next pregnancy? So I hope that this gives you a lot of hope to plan your next pregnancy. 1 year baby try பண்றோம் conceive ஆல. So HCG injection, egg rupture, yes, we have released a detailed HCG injection video. Please do watch it. Yes, again, நம்ம pregnancy plan பண்ணும்போது there are many things that we need to see when you're planning pregnancy. wife factorsum seri, husband factorsum seri, இதெல்லாம் பார்த்துட்டு தான் then we need to plan for pregnancy. Okay, what else? Hi ma'am, after anomaly scan, what scan we have to take? After anomaly scan, it is usually a growth scan. Growth scan க்கு ஒரு particular time ன்னு கிடையாது. சில பேர் 7th monthல எடுப்பாங்க, சில பேர் 8th or 9th month எடுப்பாங்க. இதுதான் particular time ன்றது கிடையாது. So உங்க டாக்டர் பார்த்துட்டு then she will examine you and then tell you when you need to take a growth scan. Anywhere between ஒரு say 30 to 34 weeks குள்ள ஒரு scan would definitely be well, and if everything is normal, 35-36 weeks also is fine. Okay, I have one question. In my 4th pregnancy, my BP was increased. 4th month of pregnancy, my BP was increased. I'm 7th month now, BP is normal. Okay, so a normal delivery kum ippo unga BP normal irukradhukum not much connection, but basically it depends on many other factors. As long as unga BP normal irukna, that's a very good thing. Number 2, baby growth nalla irukku, fluid nalla irukku, blood flow is going fine, and your baby weight is fine. You're able to end up with pregnancy, delivery, pain, effective irukku, thala irangudhu appadina daralama you can try normal delivery, but it basically depends on many other factors which only your doctor can tell you. Should I consult my gynecologist before starting exercises during postpartum? Kaveri, as long as you feel fine, as long as there are no pain or any other symptoms for you, you are feeling comfortable, you are feeding the baby, Dharalama start with mild walking, and then if you experience any pain or difficulty while doing any sort of activity, then probably you can definitely consult your gynecologist. Okay. Okay, Nandini has asked, what age women usually attain menopause? We would say there is no specific age in Solamato, but anywhere above 45. But the commonest age in India, somewhere between 48 to 52. That will be the approximate age, plus or minus 48 to 52. Anything above 45 to 55 kulla, that's one of the time, and it also depends on many genetic factors also. Unga amma oda menopause ana status very similarly irkalam, but not always. But anyway, between 48 to 52 is the commonest age. Okay, so LMP pragaram is 7 weeks 4 days, but gestational age is 6 weeks plus 4 days. Cardiac activity is faintly seen. That's okay, Arogya, because heart rate irukku, 6 weeks irukku, oru varam thalli irukku, but that doesn't make much of difference as long as the heartbeat picks up. Or 10 to 14 days later, you repeat scan pannamodu, heartbeat pick up aachna, nothing to worry. Okay, so 37 weeks baby in a breech position la dhaan irukku, ma'am. Is it okay? It's okay, but in 37 weeks breech la irukkumbodhu, it's very difficult to give a trial of vaginal delivery. So that's the only issue. It's not that we will not be able to do anything, but the chances of it coming down are unlikely. Ma'am, during pregnancy, urine infection is normal. Mahira, no time urine infection is normal. Please do get it treated, because urine infection, vaginal infection can be a precursor for preterm labor. So it's very important that any source of infection in your body, let it be dental, let it be urinary or vaginal infection, if you find a source of infection in your body, get it treated right away, because we don't want to deliver preterm. So that's very, very important. Okay, exercise post surclage removal. Okay, இப்போ புதுசா Work out. Okay, good. So, what are the other questions? Okay. Yes, 30 weeks. Can I start basic walking exercises? Yes, you can, as long as your doctor has said okay. And you can definitely start your normal basic walking exercises. 22 weeks pregnant. 1 second. Got stuck. Okay, 33 year. Okay, I think it's stuck. 33 years marriage பண்ணல என்ன problem வரும் ma'am baby ka. Okay, so Sita, there is 33 years in a specific ஒரு age factor வச்சு மட்டும் நம்ம பயப்பட வேண்டாம். If you getting married at 33, that's absolutely okay. And you don't really have to worry about it, because எல்லாருமே when we plan pregnancy, say இப்போ வந்து they get married at 28, 29, they have their first kid at 30, 31. They tend to have their second kid only by 34, 35. So it's become very common these days. So நீங்க 33, 34க்கு நீங்க ரொம்ப பயப்பட தேவையில்லை. தாராளமா you can plan your pregnancy. Try naturally for 6 months to 1 year. And if it's not leaking naturally, do contact a gynecologist and they'll help you out. Absolutely no problem at all. Cough syrup editha baby movements kammi aguma? No, not really, ma. You will feel a little drowsy, but cough syrup kum baby movements kum we even so far naanga paathadilla in the difference. So okay. Okay, ma'am, it's been 2 months. I've added sugar to my diet. Can I add sweets? And again, this also depends on, if you have sugar-based item, I get vomit. But that's okay, as long as you're having vomiting along with that like sugary substance, that's better to avoid it rather than including it in your diet. 22 weeks pregnant in an anomaly scan says low-lying placenta. Is it normal? Shubha, 22 weeks, that's absolutely all right. 7 months, valara, then the placenta goes up. So 95 to 97% of the time, nanjukodi mele poidum. So adanala don't worry if your placenta is low-lying at 22 weeks. Okay, so plenty of questions, almost adhe marida repeat agadu. Watery discharge, placenta low-lying, and watery discharge associated with itching, foul smelling, curdy white irukku appadina definitely needs treatment for vaginal infection. Ma'am, 35 days thalli poirukku, 3 drops brown discharge, next day bleeding aachu. Probably it's just collected blood, ma. Hold on for few days until you get proper blood flow. 29 years, second child, but 2 times IVF failed. When checked, no issues. Kavita, basically what happens is there's something called idiopathic, அதாவது காரணமே தெரியல. Almost 20 to 30% of them, we don't know why pregnancy is not happening. So if you have tried IVF so far, then there are next steps like ICSI or PGD or PGS. So please do contact fertility specialists. They will definitely be able to guide you. 3 centimeters cervical length at 8 weeks is perfectly normal. 2.5 to 3.5 is fine. What else can we take? Okay, it's almost the same, cervical length and placenta and white discharge. 1 second. Thyroid problem irukku, ma'am. Pregnant agala. Okay, so basically it's very difficult to say. நம்ம ரிப்போர்ட்ஸ் இல்லாமல் ரொம்ப கஷ்டம் அது சொல்கிறது. இஃப் தைராய்டு இருக்குது அப்படின்னா, do get your reports done, do check your thyroid levels, முக்கியமாக TSH levels, அப்புறம் உங்கள் regularity of periods, plus TSH levels அதிகமாக இருக்கா கம்மியாக இருக்கான்னு பாருங்கள், T3 T4 levels பாருங்கள், thyroid antibodies பார்க்கணும். ஸோ all this makes a role. ஸோ அப்படி எதாவது இருந்ததுன்னா please do get the report so that we can discuss. Anterior placentanaல எந்த ப்ராப்ளமும் இல்லைம்மா, that's a normal thing. And mild breathing issue in pregnancy, is it normal? Yes, it is. It is quite common. நிறைய பேர் they find it little difficult to breathe during pregnancy. நீங்க இப்போ ரொட்டீனாவே எல்லா மதர்ஸ்க்குமே pregnant மதர்ஸ்க்கு எக்கோ அண்ட் இசிஜி எடுக்கிறோம். ஸோ அப்படி இருந்ததுன்னா ப்ளீஸ் டூ டேக் இட். What else? Okay. TSH of 25, 150 microgram office. Yes, TSH of 25 படிப்படியா கம்மியாகும். 150 is okay, but next 3 weeksல repeat பண்ணிட்டு பாருங்க. I think most of the questions are again getting repeated with placenta and நம்மளோட fluid and white discharge. Yes, definitely I'll be able to answer all those questions. And இப்போ நம்ம frequent we are planning live both on Instagram channels and YouTube channels. And thank you so much all of you for joining me live, even though it was pretty late. I'm so sorry again. And I'm sure that I'll be seeing you all in another live video session pretty soon. So do keep watching our Instagram and YouTube live channels. We will definitely be joining you soon. Many more times pretty soon. Yeah. Thank you so much. Have a great weekend. Bye bye. See you.